Hi, welcome. Thanks for joining me. We are going to be discussing the complexity approach today. So, thanks for being here and let's get going. So, the complexity approach essentially it was founded by a few different people. Judy Guy Root was one of the core founders, and then Mary Elbert and Dan Dinson have also participated a lot with this approach. Who is this approach appropriate for? So, with this approach, a lot of the research has been applied to kiddos in preschool or anywhere between like 3 to 7 years old. And most of the kids that this is applicable for are going to be those with pretty severe phonological disorders. Um, at least somewhere between a moderate to severe range is probably best for this approach. This approach is founded on two different theories. So one of the theories is going to be distinctive features theory. And what this theory says is that distinctive features are going to classify the different sounds that we make. And so, for example, a sound like a would be classified as being nasal, as being voiced, and it's going to be classified as not having characteristics of other things. And so one of the things that distinctive features uses for this particular approach is that certain sounds with certain characteristics are considered to be more complex than others. So, for example, a sound such as nasals, liquids, or glides are going to be less complex than sounds like fricatives and affricates. And then we also have the linguistic universals theory, which actually has three types of complexity under it. So the epistemic perspective, essentially what that is going to say is that it's a broad description of a child's phonological system and the components that are required in order to treat that system. And so the epistemic perspective, I like to view it as really just like a broad overview of a kid's whole phonological. Now, the ontological perspective, this one is a little bit more detailed. This is going to be talking about the parts that go into the hierarchy of the system. And so those parts could be something like the features within somebody's system. It could be the segments or the syllables within a kiddo's language system. Lastly, in the linguistic universals theory approach is the theory, is the functional perspective. And what the functional perspective says is that the principles and rules that regulate and govern essentially the working of the system. So I kind of like to look at this as like the phonotactics, because these are the rules based around the kiddo system or their understanding of the rules. So those are the theories, the two theories that complexity approach are based on. Okay, now let's look at intervention. So how do you actually apply a complexity approach? Now, the main idea behind complexity approach is that you're going to want to apply more advanced principles first. And then the knowledge of those from that, is going to bleed over into like simpler principles. And so a few things that you can look at with this is to target non-stimulable sounds. And what that means is that a kiddo may produce a certain sound by themselves 20% of the time. They may produce another sound, none. So what you would want to target is the sound that they're not producing at all, with the hopes that by targeting that sound, you're going to see a bleed over into development of other sounds as well. An example of this would be to take later developing sounds. It's likely that those sounds are not going to be stimulable in a kiddo with a severe phonological disorder. And so say that you're working on the sound right here. But the kid also has difficulty with p, b, and f. And so by working on th and s, you might see some bleed over into those, what would be considered an earlier developing sound. We're also going to consider working on consonants that are more complex. And this is going to go into kind of both of these theories, but I like to consider it more of distinctive features, because you're going to see that more complex features, such as something that's strident or lateral, is going to bleed over into more simplistic features. So something like a stop would be considered simpler, rather than a more complex sound that would be considered later developing. So you're going to want to work on those first, and then with a lot of research, they've seen that working on those later developing and more difficult sounds and phonemes, it's going to see carryover into the simpler ones. This goes as well for complex clusters. So working on something like KW or TW, it's considered to be a little bit harder for kids. But by using that, you're also going to see some development in simpler consonant clusters that they might not have yet. Something that's really important is that your target words should be high frequency. And so essentially what you should take from that is that you're using words that are very applicable to the kid's life. If you decide that you do want to work on, then make sure that you find words that are relatable to them, regardless of their age. Like, find something that is fitting for what age they are and what they see in their own life. You also want to consider how consistent the error sound is and the number of errors that they have. So you want to target those sounds that are greatest in error and that are most consistently in error. Okay. And then with maximally opposing sounds in empty sets, essentially what that means is that you're going to base the number of differences, like the number of different features of a phoneme. And so the greater complexity a sound is, the greater change that you're going to see over time. That's really important. So a lot of this approach is going to take a little bit longer than something like a traditional approach, but you're going to see greater carryover. So you really have to consider what is best for your individual client. Okay, empty set essentially means that it's none of the phonemes that they already have. So you're going to have maximally opposing sounds, and that is essentially like the characteristics of the sound, in empty sets. So empty sets meaning they don't have any of those sounds in their repertoire. As for the session lengths, this isn't something that is super set in stone yet because more research still needs to be done on it. But what's recommended and what has been seen in most studies is approximately 30 minutes, 1 to 3 times a week. Some of the resources I've seen have said 30 minutes to an hour, but most likely you would be using this approach in a school, and an hour is just not a realistic time frame, especially 3 times a week. So there have been that have seen good progress in kiddos using 30 minutes for 2 times a week. So that is the complexity approach. Feel free to let me know if you have any questions, and thanks for joining me.